Big changes are coming to Medicare this year. From increased premiums to reduced drug costs, 2026 is bringing some of the biggest shifts in years. On this town hall, Medicare, the big changes that affect you, we'll gain insights from experts, hear about real-life stories, and provide some of the information you need to help you get the most out of your coverage. That's coming up next.
Thank you to the Eunice Joyce Gardner Charitable Foundation for its leadership support of the Health Channel.
Welcome to Medicare, the big changes that affect you. I'm Carla Hill. Thank you so much for joining us. For the more than 66 million Americans who rely on Medicare, keeping up with the changes and choosing the right plan can be a daunting task, but that's why we're here. Over the next 30 minutes, we'll highlight some major changes in Medicare coverage for 2026, and we'll update you on exciting news that could save you money on many common prescription drugs this coming year. But let's start things off by sharing information from the new administrator for the Centers for Medicare and Medicaid Services, Dr. Mehmet Oz.
Hi, Dr. Oz here. Now that I'm living my best 65-year-old life and have had a chance to really get to know Medicare, I thought I'd pass along a few easy things that you can do to get the most out of your Medicare experience. You're welcome. First, sign up for a Medicare account. Trust me, it's going to make your Medicare life a lot easier. You can look at your current coverage, you can add prescriptions, you can pick your favorite pharmacies, you can compare plan costs, you can learn how to cheat at pickleball. All right, I made that last part up, but the rest is true. It can all be done at medicare.gov/account. What's not to like? Second, go digital with Medicare. We're about to send you a lot of paper and maybe some paper cuts. Ooh, they hurt. But you can avoid both. Who needs paper when you can have everything you need in the palm of your hand? Opt to get the Medicare in You handbook and your Medicare claims electronically through your Medicare account. It's quicker, it's greener, and hey, you're saving some taxpayer money while you're at it. That's a win-win, people. Third, get in the know with Medicare's email list. Yes, you can get personalized Medicare tips, wellness info, updates about open enrollment, and much more right in your mailbox. You may even get a video once in a while from yours truly. We promise not to overload your inbox. And always, this is important, guard your Medicare card and help me crush Medicare fraud. These scammers will do anything to steal your Medicare number. It's valuable. If someone calls or texts or emails asking for your Medicare number, just shut them down. Hang up, delete the message, and remember, this is a scam. So there you go, folks. Give these tips a try and you'll be making the most of your Medicare experience like a pro. And remember, you got the Medicare team at your fingertips. Yep, 24/7 access to official experts. So start with Medicare.gov or just call 1-800-MEDICARE.
Just to repeat that last line, there's a lot of great information to be found at 1-800-MEDICARE. And speaking of great information, we are so fortunate to be joined by our truly great and very knowledgeable panel of experts. Joining me in the studio is Dr. LaToya Lewis, the Associate Professor of Clinical at the University of Miami School of Nursing and Health Studies, and Dr. Richard Wong, a critical care clinical pharmacist with Holy Cross Hospital, who will help explain some of the exciting changes in drug prices. And joining us virtually is Dr. Joel Caschette. Dr. Caschette is the Chief Medical Officer for United Healthcare of Florida, Puerto Rico, and the U.S. Virgin Islands Division of Medicare and Retirement. Thank you all for being here. Dr. Caschette, let's start with you. Dr. Oz offered some good tips, but what can you add from an insurance company perspective about how Medicare is different this year?
Well, Medicare and Medicare Advantage is different this year, and it's also changing for next year because of several different factors, including reduced funding, rising costs, changing consumer expectations, and new regulations. As a result, plans may adjust their coverage and also their cost shares. So people who have Medicare and Medicare Advantage plans may see a change in their out-of-pocket costs. In addition, with some Medicare Advantage plans, there may be fewer options and there may be a change in benefits. One thing to keep in mind is that at United Healthcare, we're working to preserve access, affordability, and high quality care. To do that, what we're doing is keeping the most valuable benefits, the ones that are central to meaningful care for individuals. And these can include things such as $0 premiums for Medicare Advantage plans, also $0 copays for primary care and preventative care. The whole idea is to be able to offer Medicare Advantage coverage for members both today and tomorrow.
Dr. Lewis, talk to us from a medical point of view about how these changes are going to affect people this year.
So essentially, in regards to the changes, we want everybody to do a deep dive and assess what are your needs. Are your needs including transportation? Are your needs lower drug costs? What is the picture that you would like to play for the next year of your health care? Next, we're also looking at the fact that for individuals who have chronic illnesses or chronic diseases, healthcare providers are actually going to get dedicated time to continue with that care and answer your questions and address conditions. In addition to that, what we're seeing with the new Medicare is that individuals, if they're experiencing palliative or end-of-life care, we know that the signature process, the transition process will change. The goal with the new Medicare updates are to create a seamless process from preventative to the end of life for patients.
And now, Dr. Wong, we'll get into the specifics of medications a little later. But for now, would you like to add the differences in drug coverage that our audience can expect this year?
Yes, Carla. So as far as the new Medicare Part D drug coverage differences, there are a few key points that it's worth noting. First thing is the increase of the out-of-pocket expenses. There is a cap on that. That cap for this year is $2,000. It's going to go up by $100 to $2,100 next year. The premium will also, unfortunately, will go up from $590, be a $25 increase to $615. For something new, a new feature of Medicare this year is that there's going to be a Medicare prescription payment plan, or MPPP, of which the Medicare beneficiary can spread out their yearly costs, out-of-pocket costs, and then pay it within the calendar year without any difficulty. So next thing would be something that I think there'll be more impact is there's a negotiation, and it's ongoing, and it's between the CMS and the various drug companies to try to lower the high-cost prescription drugs. Usually they're the tier 3 and higher drugs. And I believe that's going to benefit our seniors very much.
And we'll be talking a lot more about that later. Thank you so much, Dr. Wong. For 2026, enrollment runs from October 15th through December 7th. And this year, Medicare continues to undergo some of the most significant changes made in a generation. But before we get to those changes, let's define exactly what Medicare is. Medicare is health insurance for people at least 65 years old. Also, it's available to people under 65 years old with a disability. You must be a U.S. citizen or a lawful U.S. resident for at least 5 years. So, Dr. Lewis, I think it's safe to say that the value and importance of Medicare for those who qualify, it just really can't be overstated.
Yes, definitely, Carla, because what we're seeing are individuals who require consistent care, whether it's preventative or chronic care. Now, these individuals need access to care, as well as we want a seamless process to support them to stay enrolled in Medicare, because as we notice that there are different enrollment changes, we want to make sure that everyone is knowledgeable about these various changes, because it will impact from access to care as well as access to support. There are now programs that will be put in place for individuals where they can access a provider 24 hours, which is extension of what was previously there for 2025.
That's really great to know. Dr. Caschette, we're going to discuss the different plans shortly, but I know so many retirees and older individuals feel overwhelmed when they try to keep up with the changes. What advice do you have to help make the annual open enrollment process a little easier for people?
Well, it can be difficult at first to make choices, but it doesn't have to be. A couple things I would keep in mind. First of all, review your current coverage and see if that still works for you. Also, you want to make sure that the benefits that you're using this year are something that will be available next year. Second, consider your budget. Is your plan a good fit for it? If so, great. Keep in mind also that not only do you want to look at the monthly premium, but there's also copays, coinsurance, and deductibles that lead to out-of-pocket costs. Third, you want to confirm that your preferred doctors and the hospitals that you use are part of the network if you have a provider network with your plan. You want to make sure to have access to affordable, quality care. As a matter of fact, we're seeing more HMOs or health maintenance organizations this year, and that involves getting care within a specific network of providers. If you have an HMO, you want to make sure that your providers are in that network. Lastly, you don't want to forget about dental, vision, hearing, and other services. Many people use those over time, and one thing to keep in mind, it's interesting that original Medicare doesn't necessarily cover those, but Medicare Advantage plans, many of them do.
Thank you, Dr. Caschette. Now, when it comes to choosing plans, I know it can be very confusing for our viewers, so we want to share a video to help explain more about the plans. We call it the ABCs of Medicare. Take a look.
When you're first getting started with Medicare, there can be a lot to learn and consider, and it might seem overwhelming. Let's start at the beginning with the ABCs and D of Medicare. Medicare includes parts that are the building blocks of your health and drug coverage: Part A, Part B, and Part D. And there's also Medicare Advantage, sometimes known as Medicare Part C. Let's start with Medicare Part A. Medicare Part A is sometimes called hospital insurance. It covers hospital care, like inpatient care at a hospital, skilled nursing facility care, hospice care, and some home health care. Usually, you don't need to pay a monthly premium for Part A. Medicare Part B, or medical insurance, covers services like certain doctor visits, outpatient care, medical equipment like wheelchairs, and preventive services like flu shots. With Part B, you'll pay a premium every month. In many cases, if you don't sign up when you're first eligible, you'll have to pay a late enrollment penalty, which is added to the monthly premium cost for as long as you have Part B. That can add up, so it's important to pay attention to your deadlines. Medicare Part A and Part B are both under what's called Original Medicare. If you want drug coverage too, then you can join a separate Medicare Part D plan. Medicare Part D coverage is provided by private companies that you can choose from. For a Medicare Part D plan, you'll pay a monthly premium that depends on the plan. Remember to consider your plan options when you're first eligible to avoid late enrollment penalties.
As we mentioned earlier, some big changes are coming to Medicare, including caps on drug costs and adjustments to premiums and deductibles. So let's take a look at some of those. So Plan D is the out-of-pocket expenses, and that'll be capped at $2,100. There will be reduced drug prices on several common medications, and we'll get more in-depth on that in a moment. Dr. Wong, I think the biggest and the most important thing that we've just gone over is this $2,100. Can you talk more on that?
Yeah, sure. From the Inflation Reduction Act that was signed into 2022, basically that caps the total out-of-pocket expenses to $2,000 beginning this year, 2025. And that cap is going to go up to $2,100 beginning at 2026. So what that basically does, prior to 2025, there is a gap, of a coverage gap, or donut hole they call it, where the beneficiaries will end up paying a bigger chunk of their medication costs before they get to the catastrophic phase. But for this, because of this cap, they basically eliminated that phase. So let's say, God forbid, the individual had a health crisis where they're diagnosed with some illness where they would require a high-cost medication. That basically it's going to throw that individual into a financial crisis. So with this cap, it saves them. After $2,100, they're saved. They don't have to pay any more on prescription medications.
Thank you for that. That's important. That is really important information. Dr. Caschette, we have some more changes to Medicare that we're going to show on the full screen here. Premiums for some Medicare plans may rise. More HMO plans will be available to Medicare customers in 2026. And Dr. Caschette, please highlight the differences between HMO and PPO plans for our audience, if you will.
Yep. HMO plans are health maintenance organization plans, and those plans are one where you choose a primary care provider to act as the captain or the quarterback of your primary care. They are taking care of the whole person, and they're prescribing most of your general medications. There may come times when you need to see a specialist, in which case they will refer you to a specialist, usually in the network of healthcare providers in that HMO. There's usually lower out-of-pocket costs, and also there are significant benefits associated with health maintenance organizations that you may not see elsewhere. By contrast, preferred provider organizations, or PPOs, have a little bit more an open network. In other words, you can see an in-network provider where there will be a copay with a lower cost. You can also see an out-of-network provider, but that's going to be associated with a higher copay. The downsides to the PPO in comparison with HMOs is that normally those premiums are going to be higher and they may not offer the same benefits. So it's important for each individual to take a look and say, if the additional flexibility of a PPO is supported by them as far as the increased cost, then that's something that can be advantageous. But there's no one-size-fits-all plan. HMO and PPOs are two options that everyone should be looking at.
Thank you, Dr. Caschette. Dr. Lewis, let's turn to you. We have another full-screen graphic that's about some upcoming changes coming in 2026. From a medical standpoint, talk a little about what these changes mean.
Okay. So the first aspect of advanced primary care management, each month, that relates to the extension of what I alluded to before of chronic management. So we're getting the opportunity to extend that.
Exactly. So we're seeing, the will pay for advanced primary care management services that you were just alluding to, and the doctor coordinates and tailors care to the patient's needs, of course. Please continue.
Yes, as well as coverage a wide range of colorectal cancer screenings. So what that entails is a computed tomography, which is a CT, that can be done initially. And then if the individual needs a follow-up colonoscopy, they do not need an additional approval for that. It's already a seamless process in regards to prevention, because that is one of the areas of focus to improve overall care.
Thank you, Dr. Lewis. We mentioned earlier about renegotiated prices on some commonly prescribed drugs. So let's take a look at those. You'll see them on your screen. There are renegotiated prices on some commonly used drugs. Dr. Wong, I see Entresto, I see Farxiga, Jardiance, etc. Dr. Wong, I've heard many of these drugs. Certainly our audience have heard of them too. Talk about what it means to our viewers when it comes to prices on these commonly prescribed medications.
So right now for the plan for 2026 is that 10 of those drugs are on the negotiation table, and the prices have already been set. 15 more will go and for the year 2027, and another 15 or 20 will be for years beyond that. That is a long list of meds. So obviously we're not going to go over all of them. The 10 that will go on for next year, 2026, is the Entresto, Eliquis, Enbrel, the Imbruvica, the Farxiga, Jardiance, Januvia, the insulins, and the Xareltos, right? So let's just talk about one of them, for example, here. So Eliquis was made by the company Bristol Myers Squibb, and its indication is for patients with clot or to prevent the clot. And interestingly, that's on the list of the top 50 most prescribed drugs, at least from the 2023 data, and it's ranked number 28. Okay, so before negotiations, the price was $520. Post negotiation, it's dropped to $230. Now we're talking about a $290 difference, 56% decrease in price. Now, I would venture to say that most of those patients on Eliquis are Medicare age, so the government will be saving a lot of money.
That's an amazing amount.
Of money. Yes, yes. So with the price there, there is a more negotiation plan for 2027, and so we'll see how far the price will go down with each meds.
That's a lot to look forward.
Yes.
Thank you, Dr. Wong. Now let's turn to questions from viewers. First, we hear from Dennis, and he asks, my mother-in-law has a Medicare supplement plan, and while she pays a higher premium, she rarely has a copayment for services, and she can see almost any doctor. I have a Medicare Advantage plan, and I always have a copay, and I'm limited to the doctors that are on the plan. Is the premium difference that much? By the way, my mother-in-law is several years older and in much poorer health than I am. Dr. Caschette, let's give this one to you. What do you say to Dennis in his situation?
Well, when we hear about Dennis and what he is describing about his mother-in-law, I think of two things. First of all, his mother-in-law appears to have original Medicare, Part A and Part B, and also a supplemental Medicare or Medigap plan. Now, those Medigap plans can help to offset costs that Medicare Part A and Part B don't pay. Some people are surprised to find that Medicare Part B pays for 80% of outpatient costs, but the individual is usually the one who has to pay for those 20%, and there is no out-of-pocket limit. Medigap plans can help to defray and offset the costs of deductibles, coinsurance, copays, and other costs associated that may come out of pocket. Now, there's a great advantage to that, but the downside is that there can be a potential premium that's higher with Medigap plans as opposed to Medicare Advantage plans.
Thank you, Dr. Caschette. Next, we have an email from Nancy, and she asks, I get gift cards to Walmart and grocery stores to help pay for food and over-the-counter meds. I'm concerned that plans that give people some money back from Medicare are going away. Please tell me they are not. Dr. Lewis, what would you tell Nancy?
I would definitely tell Nancy to look into her plan and see if there are an amount where she can get different vitamins, supplements, her medication, because some parts of Medicare you can include a maximum of about $75, and it can vary on monthly expenses. In addition to the additional concern that I'm hearing from Mary is also, from Nancy, is also about food. There are different farm shares available. Different primary providers are also engaging in these farm shares, and that can help with food supplements, but I would let her know to fine-tune it to her needs and make sure the Medicare meets her demands.
Thank you so much, and I want to thank you all of the guests, for your wonderful insight. We have covered a lot of ground, but before we wrap up, I want to get everyone's final thoughts. So let's start with you, Dr. Caschette. 15 seconds, what message do you have for our audience as they take in all of this information?
Sure. Remember, the Medicare annual enrollment period is from October 15th through December 7th. So now is the time to look to see whether your plan meets your healthcare needs, your budget, and the providers and hospitals that you want to see.
Thank you. And Dr. Lewis, what would you like to add?
I would say get your family members involved. Technology can be overwhelming to individuals. So if you want to use the paper, that's fine, but make sure it's addressing your needs, whether it's transportation, wellness programs, primary care providers, specialists. fine-tune and don't compare to others.
And Dr. Wong, your final thoughts, 15 seconds for our audience.
Oh yes, thanks for the Inflation Reduction Act. There's so much that's going on. The prices are coming down for medications, and I believe there will be more coming up. With the current administration, they're talking with other drug companies of controlling prices. So at the end, I think that seniors will benefit from all this.
We greatly appreciate it. I want to thank again all of our great panel members for their insight. And for everyone at home, remember that the 2026 Medicare open enrollment period runs from October 15th through December 7th. So make sure to sign up and choose your plan before the deadline. We hope we helped make it easier for you to find help choosing the right plan for you. I'm Carla Hill. Thank you for joining us, and we'll see you next time.
Thank you to the Eunice Joyce Gardner Charitable Foundation for its leadership support of the Health Channel.